Welcome back to the new norm. I'm Dr. Lou Graham. My guest today is Dr. Ron Kaminer. He's here for a part two. This is brought to you by Midway Dental and Catapult Education. In part one, we were talking about the pandemic and how dentists are really on the front line as we go back to work. We talked about two different types of tests. Dr. Kaminer has been doing his own testing, meaning self-testing and patient testing, and we talked about that. Then we got into a little bit of the antibody testing. So if you haven't seen that, you got to check out part one. Now I want to get back into with Ron on really how do we best use these tests. Now let me also say that both Henry Schein and Midway Dental are absolutely coming out with these tests. I was on a management call today with the Midway team. I love being on the inside and seeing how this all works. And we are hoping to bring these kind of tests, these antibody tests, within the next 10 days to 2 weeks to multiple offices. And if this becomes protocol that Ron and I are going to be talking about, I think offices are going to have to understand how to implement these as protocols. So kudos to our distributors who are bringing us really what we need to be careful out there. Okay, Ron, let's get into it. So Ron, let's talk about the patient has done a screening. And let's say they've been around a COVID patient and it was 10 days ago or 2 weeks ago. What would you want to do to feel comfortable with that patient? Tell me what you would do.
So for me, what I would do is they have to take the finger stick antibody test. That finger stick antibody test, the way I see it, will be our initial screening tool. Finger stick, 10 minutes, we have a result. Do you have antibodies, meaning IgG is high? Or are you shedding virus, IgM is high? The problem is the test is 90% accurate. So if they're shedding virus, we then may have to have them take an additional test, either through a saliva test or being referred out to the physician. But if they have the antibodies, they should be good to go.
Okay, so I want to be devil's advocate because that's what you are always in my life. Okay, so patient comes to your office, you've booked 2 hours because you've got a lot of dentistry to do on them. They've been waiting for the work, and now all of a sudden, they said on their medical screening, I don't have a fever, I don't have any symptoms. They walk into your office, and now they're showing on the antibody test IgM. And IgM, which really probably means they're shedding virus and they probably contagious. Here's my thing. I just blew two hours. I think, and I'm just going to ask you this, why wouldn't we want every patient taking the at-home test 2 days or 3 days before they come in? I know what you're going to say, and it's okay. I'm ready for it. Why wouldn't we be creating a protocol where people are testing for the virus, going into self-quarantine then 2 or 3 days before, and then doing the antibody test? You're up.
So I think there's two reasons why that's a problem for me. One, that test is only as good as when you took the test. So if they took it on a Monday, their appointment's on Wednesday. Right now we're quarantined, but July, August, September, We're not going to be. They're going to be out and about. They're going to be in the supermarket, restaurant. So if they took it on Monday and they're negative, it doesn't mean they weren't exposed on Tuesday and Wednesday before the appointment. So that's problem A for me. Problem B is we're going to get resistance from patients saying, I'm okay. I don't want to spend $100 on a test because that's the cost of it right now to take a test when I'm 100% fine. So I think we have twofold issues why that protocol doesn't fly for me. Lou, what do you think to that?
So here's what I say. If a patient doesn't want to take the test for the $100, they can go see Dr. Ron Kaminer. I'm kidding, of course. I don't want to see that patient. I don't want that patient in my office until I know they're virus-free and we can then test for the antibodies. I absolutely think no matter what, patients will lie. I do think we're going to be wearing masks. You look in Wuhan right now, everybody's wearing masks. So I think there's going to be still social distancing. I think we're going to have to be very careful for the next 6 months to a year. I think masks, they're going to be like trendy masks coming out. But openly, Ron, I want to be uber safe. And my feeling is if a patient says to me, I don't want to pay for that test, I'm going to be put in that position where, you know what, I'm just not comfortable treating you then. Now, I can have many dentists out there agreeing with you, and I'll have many dentists out there agreeing with me. I think this is the format of a great discussion. And I'm not saying you're wrong, Ron, at all, but my feeling is if I'm a patient in Lou Graham's office or Ron Kaminer's office, I want to have the lowest risk of getting this virus, the ultimate lowest risk. And if people question that you could get the risk at the dental office, we're not going to see patients. We're only going to be treating emergencies because people are going to fear us. I think it's critical that we offer maximum safety to get back on our feet. Okay, rebuttal goes back to you. You go.
So to that, and I heard this both on CNN yesterday and on MSNBC, the question that's going to come into play is if Lou Graham, DDS, tells Mrs. Smith, I need you to take this test, and she says, listen, I've not been exposed, I'm okay, but I'm not going to see you if you don't take the test, are you violating her civil liberties? And that's already come into play. And I'm not saying you are or you're not, but I'm telling you that discussion has come into play. We can't tell our patients today, you were stuck by a needle, you need to go take an HIV or a hepatitis test. We can't do that. It violates their civil liberties. If you treat a known drug addict, we can't force them to go take a test. So all I'm saying is, and I'm not saying you're wrong, these are the questions, as the show is called, the new norm, that are going to have to be answered. Will it be okay for us to say, you need to take this test?
And I will just say, I think by the time we get back to elective dentistry, the new norm will have more guidelines. But right now, if I'm seeing emergency dental patients as Chicago starts to go through its peak, and over the summer, I'm absolutely in my world going to say this is mandatory. It's for everybody's safety. And openly, Ron, let's talk about this. How often would you be testing yourself, and how often should the assistant be testing themselves? Because I think we've got to be testing ourselves. So how frequent should we be testing ourselves? Should that be weekly with our team? Tell me your thoughts on that.
So I'm going to even flip it around further, and then we could discuss this. That same patient that you just said had to get tested. How often are you going to test that patient if they need an upper and lower reconstruction over 4 months? How often are we going to test that patient? How often are we going to test the denture patient that has to come back every week for an impression and a fitting? So these are all these questions that have to get answered, obviously.
I agree, but let's go back to, we'll get to that. But I see us, oh my God, the new norm could be one-day dentistry. There may be reasons to do one-day dentistry. Or when you're doing dentistry, we're not going to be doing 2 fillings on a crown. We're going to be like Bruce Baird says, we're going to do quadrant by quadrant because we've got to get as much done when they're in the chair based on what you just said. We don't know if they're going to be positive the next time they walk in. I hear you. Everybody's scratching their heads, getting a headache from this discussion. But I'm going to go back to this. How often would you test yourself, and would you want your assistants and your hygienists and your front team? How often would you like everybody tested?
It's a very hard question to answer. I think what I would say is as follows.
Yeah.
I would probably test, I'd like initially once a month. And because I think that's what's potentially realistic. At the same time, we're going to be wearing our protective equipment. We're going to be wearing a level 3, maybe an N95, a shield, a gown, all the things we're supposed to wear. And Lou, what I'm going to tell you is we can only do what we can do. There has to be a small element of luck in here because we could touch something or whatnot. But we're going to protect in the way we know that's prudent for ourselves. And we're in a profession where the risks are going to be there going forward, and we're going to need a little bit luck on our side. The goal is that we have antibodies. If we have antibodies, we're good. Hopefully.
Well, we think we're good. We think we're good. Right. But I still think you're going to be protective. So let's go to this. I think that as a care provider, I think we have to be unbelievably careful of our own habits And B, like a screening tool, if you start to experience anything that could be viral-like, you're going to have an immediate testing. And if you've been around anybody that subsequently has become positive, I don't disagree with the once a month, or it could be every 2 weeks, but I think if you have become exposed to somebody near you in your life or have any symptoms, I think we have to be very flexible on our own self-administration, both to our team and to ourselves. And I think you would agree with that.
For sure.
Okay. So in essence, I do believe that this antibody test in my practice will become mandatory for every patient walking in. Do you see it being mandatory or not mandatory?
100%. I think until we have vaccines, until we have injections that'll boost antibodies, which companies are ramping up already, they're testing and they believe we'll have those by summer's end, September, October, where you can get an injection and get 10 to 12 weeks of immunity. So I think until we have those things and vaccines, that finger stick antibody test will be a mandatory test for every dentist to incorporate into their practice.
Yeah, and I would say, Ron, openly that as a healthcare provider, if those antibody injections become available and the safety's been proven, I think that becomes critical for us to avoid coming down with this nasty, horrible virus. Because we have to minimize the spread of this virus. I couldn't agree more.
100%.
So I think where we agree is you got to have a good screening. You got to be testing temperature when they walk in. We have protocols. If on the screening there's any suggestion that they've been around the virus, had the virus, we'll leave it at the fact that we may want them to get the viral testing 2 to 3 days before their appointment and self-isolate, or at least be home. If they're low risk on the survey or the questionnaire, mandatory no matter what will be antibody testing in your office. Agree?
Agree.
Okay. I would say this to everybody out there. I want you to ask us questions. You have our contact information through Midway. Ask us questions. We're just trying to guide us through this. Nobody has all the answers. We just know we have to practice the ultimate in safety. Ron, any final words to our wonderful audience and attendees on this?
Yeah, I think the most important takeaway is we're frontliners. This is the profession that we're in. And we've had risks. We're always going to have risks. We've practiced safely. We may practice more safely, but we still have a great profession. So for those that are thinking, I'm done, or I'm young and I have debt, how can I do this? Or I'm old, maybe I should retire, even though I don't have enough. Just go back at it. The good news is that being a resilient society and a resilient profession, our memories, believe it or not, in good times get short. And while we'll be aware, we're still going to come out on top and it's all going to be good. So we're all going to learn from this and things are just going to get better and better and better.
You know, Ron, and I'll agree with you 100%. Look, change is always hard. I mean, I remember in dental school when we had to start wearing gloves, and that was the new norm back then. Oh my God, you've got to wear gloves and a mask. That was the new norm back then. So I do agree. I just think like you do, as we go through the next 3 to 6 months and learn more and more, I think safety, 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 and we'll all figure this out together, but it's got to be about safety. Yeah. Brother, thank you so much for the 2 segments you've broadcast us with, and I'll get you back on the show as soon as we have more to argue and share. Thanks Ron,
Lou,
for being here.
Appreciate it. Thank you.
Take care, bro. Yeah, thank you. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.